Dear friends, I'm Dr. P.P. Bose. I'm a senior consultant pulmonologist. Every year, 24th March is celebrated as a World Tuberculosis Day. This is the day Robert Koch in 1892 discovered mycobacterium tuberculosis as a causative organism of tuberculosis. Tuberculosis in India is a very pathetic situation. Still, with this modern intervention, this disease is rampant. And if I may share one of the important statistics in 2019, 27 lakhs of people suffered tuberculosis in India, and 79,000 of people died in tuberculosis, which comes to around 20,000 in a quarter. And when we compare these deaths with the COVID statistics, in the peak of COVID in 2019-20, we had almost 15,000 in a quarter area. So 20,000 and 15,000. So 20,000 quarter. You can imagine how bad is tuberculosis in India. We had all sorts of tuberculosis, but the lung tuberculosis is the most commonest form. We have gland tuberculosis, pleural tuberculosis, pleuropedicle tuberculosis, intestinal tuberculosis, all possible tuberculosis as pulmonologists we see in our clinical practice. But one very interesting thing which I'm noticing in the last few years of my clinical practice, that even the elite sections of the society is getting tuberculosis. One of the reasons could be we don't take care of our immune system, we don't eat enough, maybe our nutrition is not very healthy, maybe we are not doing enough of workouts, maybe because of poor mental health, or it could be because of poor sunshine. Whatever may be the reason, that tuberculosis is coming in a very big way in all sections of the society, and we are getting all kinds of difficult tuberculosis. Lately, I'm finding a lot of pleural tuberculosis. The pleura is the surface of the lungs where the people come with a lot of collections, in all age groups. I'm getting it: young, middle age, elderly. And let me tell you, India is the tuberculosis capital of the world, perhaps, and it is presumed that you will have tuberculosis, and that's why we all get the BCG vaccination. Despite with the BCG vaccination, if you get pleural tuberculosis, that means your immune system is poor, because pleural tuberculosis, or the tuberculosis which goes into your visceral area, it's basically non-communicable. That means it normally happens when your own immune system goes down. It is a reactivation of your weak tuberculosis bacilli which is injected in your body as a form of vaccine. So dear friends, it's quite a concern. And one of the studies says that from the private world, around 38 to 40% reporting of tuberculosis is coming in all forms. And one of the reasons could be diabetes. India is the diabetes capital of the world. Every sixth person is diabetic. So all comorbidities, poor health, obesity, diabetes, poor mental health, huge stress, lack of physical activity, poor nutrition, all probably playing a very important role in rampant tuberculosis. Friends, we as pulmonologists, in collaboration with other social sectors, we are pledged to take this in a very big way to create more awareness about tuberculosis. We are also doing a lot of social initiatives and talk programs so that we can sensitize the society about the need to discuss this kind of rampant tuberculosis. We need to enhance our immune system. We need to talk about nutrition, the mental health, and other possible factors which can weaken our immune system, because tuberculosis is basically a disease between host and parasite. If somehow the host goes weak, the parasite takes an advantage. So don't allow this parasite to take the advantage, which is it's there in the air. And one very interesting thing about tuberculosis is that it stays without creating the havoc for months and together and months and years. And this is what you call latent tuberculosis or dormant tuberculosis. Because the tuberculosis spores can be found in very shady areas, dark areas, because since we are not getting enough of sunshine, because in those days we used to have a lot of good sunshine in the house, so no longer the houses are good sunshine houses. So tuberculosis bacilli in the form of spores can attack you at any time whenever your immune system goes down. And in COVID time, when the healthcare system collapsed, the many of the programs the government used to run, the directly observed therapies and other surveillance program also went for a toss. So this also could be a reason that tuberculosis got a little complicated and we started getting more tuberculosis in the post-COVID times. So we are lately getting a lot of tuberculosis in our clinical practice. So it's a need of the hour to practice three things: think, test, and treat. These three T's are very important, and one of the guidelines which we are talking from the CDC guidelines that we have to think. Now, what do we have to think? Tuberculosis can hit you anytime. So you always believe that your house may have tuberculosis bacilli. You may have a poor immune system. You may be going into the cluster populations. You may be exposed to the society, those who have tuberculosis, because it can spread through your droplet infection, sneezing, coughing, and all those things. So somehow you have to take care of yourselves. You have to be very positive. You have to think and you have to introspect that you may be one of the victims of tuberculosis. So friends, you have to think and introspect. If you're a diabetic, if you're obese, if you have a weak immune system, if you're not taking care of your health adequately, you may be at a risk of getting those latent tuberculosis. So you have to think. Take care of your immune system. You have to work hard. You have to control your metabolic parameters. All possible proactive measures you have to take. Then, of course, whenever you have the symptoms of cough, which is persisting, low-grade fever, visit your pulmonologist, get the testing done. Now we can test through blood test is available, the skin test is available, and the sputum test. The testing is very important, and now there's a lot of modern testings we can identify and pick this tuberculosis at a very early time and treat them. We have wonderful treatment available, and most of the early treatments are 100% successful. The good drugs are there, the bactericidal drugs, if we treat in time, so results are very good. So treatment is there. Only thing is that one has to understand this, all these drugs, if you have tuberculosis, one drug doesn't work because tuberculosis is pleomorphic. One organism has different behaviors. Some are slow, some are fast, some are very dormant, some are very, latent. So all kinds of population of tuberculosis bacilli normally there when you have tuberculosis. So always see to it that whenever you are treated with tuberculosis, you should be receiving the primary bactericidal drugs or in the intensive phase. The intensive phase normally lasts 2 to 3 months. An intensive phase, you should have INH, isoniazic acid, rifampicin, ethambutol, and pyrazinamide. These 4 drugs are must, and whosoever is treating your physician, and they should be aware enough to know what is the dosage, and the right dosage is very important, and all these drugs should be given in empty stomach. So if you have a metabolic disorders, if you have a weak immune system, if you didn't work out much during COVID time, get into your shoes, start doing workout, get good sunshine, have a regular body checkups, and be introspective. And if you have all these symptoms, consult your pulmonologist and get the right treatment. Because many of the treatment what we are getting is that not adequate, and that's why India has become a country of multi-drug resistance or extended drug resistant tuberculosis. And now we are talking about total drug resistance. It's quite a concern. The drugs don't work. So now we have got second and line drugs and special drugs. So if you want your tuberculosis to be treated, you should know what is the dosage, and everybody should chip in. It's everybody's role. Everybody should be empowered to create an awareness about tuberculosis. And a few basic things which I place on behalf of SANS Foundation, that see to it that your house is sunshine. See to it beds get enough of sun. You go for your regular workout, at least spend 30-40 minutes of workout. Take care of your body parameters. Stay healthy, sleep well, breathe well, do follow breathing exercises. And if you have any one of the symptoms, or if you think that somebody has got cough and cold for a certain duration for 3 to 4 weeks, get evaluated. And if you have the tuberculosis, don't get perturbed. With the right dosage, as per the WHO guidelines, you can come out of this disease. It's a 100% treatable disease. And one thing I must tell you is that HIV and tuberculosis is a tremendous interlink. In HIV infections, the tuberculosis is 20 times higher. So any kind of immune compromised disease, those who have got HIV or immune compromised disease, those who are headers of steroids or autoimmune diseases, or any kind of lymphoproliferative disorders or malignant disorder, they should be very careful. They should try to follow a good lifestyle and keep checking about it. So think, test, and treat. These are 3 T's, very important. And as a pulmonologist, it's my moral responsibility to educate the mankind. And let's create a chain to change the society. WHO tried a lot of initiatives, Indian tuberculosis programs could not do much, but now the government has decided to convert the national tuberculosis program in what is called total eradication program. So now government is working very hard, and a lot of proactive initiative has started to eradicate tuberculosis by 2025. Now we have a digital X-rays, surveillance program, drug sensitivity test, and the pivotal drugs, the RAFMPC. Now we have a CBNAT test, the nucleoside assessment test, CBNAT test, and all kinds of supports the government of giving. There's a lot of private government partnership which is going on, and the government is giving tremendous amount of initiatives, and hopefully with the public private partnerships, with the community initiative, we will able to come out of this dreadful disease. So keep these disease, we have learned a lot about COVID times that immunity is very bad for the human system. So let's work on a good immune system, and always keep in mind that tuberculosis can be there in your house. It may be in latent forms. So do all those things which I discussed with you so that you can make our society tuberculosis free. Stay healthy, stay fit, enhance your immune system, and spread the good things. And just work on your immune system. Have a great day. Regards, Dr. Bose.